One question I get asked all the time as a pregnancy and fertility dietitian that primarily treats PCOS is, how do I calculate my due date? This is really important for you to know so you can avoid unnecessary interventions at the end of pregnancy, like induction. I've also seen information that a woman has had about her own body save a pregnancy. So buckle up, I'm going to tell you all the things you need to know to calculate your PCOS due date. I'm Caitlin Johnson. I'm a registered dietitian that treats infertility and PCOS every day, and I can't tell you how important it is that we zero in on your accurate estimated due date. So if you're already pregnant, listen up. If you're not pregnant, make sure you like and subscribe to this channel so you can come back to this video when it's your time and you get your big fat positive. Okay, let's talk cycle mechanics and how an estimated due date ever came about. There is this rule called Naegeli's rule, where you can say the first day of my last menstrual cycle, I'm going to count forward 7 days, and then I'm going to subtract 3 months. So you take the first day of your last menstrual bleed and you add 7 days to that. We're going to use simple numbers here. Let's say the first day of my last menstrual period was January 10th. Okay, so add 7 days, subtract 3 months. So January 10th, we're going to add 7 days. That's January 17th. We're going to subtract 3 months. January to December, 1 month. December to November, 2 months. November to October, 3 months. October 17th. Fun fact, that's actually my dad's birthday. That's how in any normal OB practice, they're going to try and calculate your due date. This is an estimated due date. It's just estimated. For a first-time pregnancy, the actual gestation of pregnancy, how long you're actually pregnant, is 40 weeks and 5 days. Okay, that's the average. But this calculation that I just gave you gives you a gestation of 40 weeks even. Let's throw a curveball in here and pretend you have PCOS, because if you're watching this video, it's very likely that you do. PCOS can manifest itself in a number of ways, and one of the ways it does is anovulatory cycles, meaning you're not ovulating, or oligoovulatory cycles, meaning you ovulate infrequently. Because of this, most women that I treat with PCOS, they don't have your normal cookie cutter 28-day cycle. They can't just rattle off their tongue at their next OB appointment that the first day of their last menstrual period was January 10th. You may actually have to think back in your memory or go to your app and realize it was 3 months ago or 7 months ago. So if we use that number to calculate with Naegeli's rule, or we just count forward 40 weeks, which is going to give you the same day, we're going to find that you're probably super pregnant compared to how pregnant you actually are. Can you see where this is a problem? Okay, we're going to talk about a client of mine named Julie. Julie cycled regularly, so she wasn't one of the gals that never cycled. We had kind of an idea at what cadence her cycle came. And I taught her to do something called basal body tracking. She tracked her basal body temperature when she woke up every single day. She had charts that showed us when she was about to ovulate and that confirmed when ovulation happened. So 4 months into working with Julie, we get this big fat positive, and she calls the doctor's office to schedule her first pregnancy appointment. Usually in this first appointment, they'll collect your urine, they'll draw your blood, and very often they will do what they call a dating ultrasound. Dating ultrasounds are most effective and most accurate in the window of about 8 to 10 weeks pregnant, okay? When she called the doctor's office, they asked, what was the first day of your last menstrual period? And she told them. And so they estimated that she was about 7 weeks pregnant. So they scheduled her visit for 1 week later so they could schedule her ultrasound in that really sweet spot. Now, Julie didn't know that they were trying to do this. And when she went to her first appointment, they estimated her due date based on her first day of her last menstrual cycle was out about 40 weeks. It put her being about 8 weeks pregnant. By 8 weeks pregnant on an ultrasound, you will see a baby's heartbeat. When they lubed up the little probe that they use for an early dating ultrasound, because this is an intravaginal ultrasound, they inserted that within her vagina and started moving it around to see what they could find. And they found evidence of a baby that had implanted, but they did not see a heartbeat. The doctor came in with some hard news and told Julie that she had lost her pregnancy. Now you can imagine how disheartening and discouraging and just horrifying this experience was. The doctor offered her that she could proceed and let her body process the miscarriage on its own, or that he could give her medication that would hasten that process for her. She left with the prescription in hand and called me right away in tears. And I said, Julie, let's just stop for 1 second. Let's make sure you're actually as far along as they have you. So take a deep breath, take a minute, let's pull out your app, and let's make sure in the app that you're actually as far along as they think you are. So she pulled out her app, and sure enough, when we looked at it, she had only ovulated about 13 days prior. And at that point, on an ultrasound, you are not going to see a heartbeat. So what I advised her to do was to not fill that prescription, to not take that medication, to call the doctor's office back and say, before I proceed with anything, I want a second opinion in 2 to 3 weeks. And by then she would have been far enough along for them to see a heartbeat. She brought a friend with her for emotional support for this follow-up ultrasound. The ultrasound tech had no idea about this previous experience and that she was coming in to confirm whether she had miscarried or not. And they set her up, they started probing, they were looking there, and sure enough, the ultrasound tech said, here's your little baby, and turned the monitor on, and Julie heard her baby's heartbeat. That baby was alive. That baby existed. That baby was not miscarried. That baby is 3 years old right now, and he is a beautiful, thriving little boy. So it's very important that we have some cycle literacy and understand a little bit about our cycles so we know when we ovulate that we're tracking intercourse, so we can say, hey, this was ovulation and this is when we had intercourse around it, so we have an idea of a conception date so that you and I can estimate your due date and estimate how far along you are gestation-wise so that we can inform our medical providers in a way that we're advocating for ourselves and our babies. I would like to recommend how you can calculate your due date knowing that you have PCOS and potentially irregular cycles. I want to educate you and inform you so that when you are at your doctor's appointment confirming your pregnancy, you don't have to live through the horror that Julie did. The other reason why it's really important for you to go into an ultrasound in your first visit with your obstetrician or your midwife after you confirm pregnancy at home is that getting an accurate due date that's estimated is critically important. Why is this important? It is widely known that women with PCOS have higher risks of pregnancy complications, things like gestational hypertension, gestational diabetes, preeclampsia, and early preterm labor. There are many reasons why you should be medically induced. Having miscalculated your due date is not one of them. Let me say that again. There are reasons to be medically induced. Having miscalculated your due date because you had irregular cycles is not a reason for your doctor to medically induce you. Okay, so let's talk about some cycle literacy and how you are going to calculate your due date more accurately. One thing that you can do is go to any run-of-the-mill pharmacy or health store and ask for a BBT thermometer. A BBT thermometer is a little bit different than any other thermometer you might have in the house to check for fever. The way that it's different is it's more sensitive. It can get a more accurate reading. It goes to a second decimal level. So most thermometers go to like 98.6, 98.7, or in Celsius, 36.4, 36.8, okay? We want that second decibel, 98.72, 36.48. That second decimal tells us that this thermometer is specific enough to register changes, very subtle changes in your basal body temperature. I'm going to put a chart up here. This chart shows how before ovulation, you kind of float around in the low 97s. And as soon as ovulation occurs, right there, you're going to see the temperature shift up about 0.5 degrees. So usually it'll go above 97.5, all the way up even into the low 98s. So after ovulation takes place, you'll see that basal body temperature climb up above 97.5, even into the low 98s, and stay consistently there either until your period comes or it will remain high if you're pregnant. Progesterone is that mother hen hormone that holds your body to a higher temperature so that it can incubate, cause cell division, and help you grow a baby. So that temperature will stay at indicating pregnancy. From that first temperature spike, you can add 38 weeks and calculate your due date. So I'm going to say that again. If you're charting and you see that first temperature spike, that is ovulation, conception will have happened within 24 hours of that, you can add 38 weeks and that is your due date. So in order to calculate your due date, we're looking for more than just knowing what was the first day, the last time you had your menstrual cycle or you bled. We're actually looking for ovulation occurrence. And from there, we're adding 38 weeks. We're not adding 40 because 40 would account for that first 2 weeks before ovulation in a normal length cycle. You and I, we may not have normal length cycles. So zeroing in when ovulation occurs is really important for us. Now you can do this a little bit more directly if you're using things like ovulation predictor kits, but those do not confirm that ovulation took place. Those just give you a preview that ovulation may come. May is a good word to asterisk there. May not actually happen, but it might happen. And if you see a positive OPK and about 2.5 weeks later you see a positive pregnancy test, you can pretty much guarantee it was around that time that you did ovulate. But that's not a perfect day. You can ovulate within 2 days of an OPK. You could ovulate within 12 hours of a positive OPK. So you're not going to be too far off in estimating that due date. I want to talk to you about when I was pregnant for the first time. We'd been trying to conceive for about 3 years. I had been tracking my cycle with BBT for a very long time, an oral BBT. Okay, so a thermometer that I put in under my tongue as soon as I woke up every single morning. I saw when ovulation happened. Okay, so we confirmed ovulation. We had had intercourse within 5 days prior to that ovulation, and sperm can live within you for 5 days with quality cervical mucus. I confirmed ovulation and I added 38 weeks from that ovulation date. When I hired a midwife, the midwife ordered an ultrasound. We went into the ultrasound tech and we did the calculations that they had based on how baby was measuring at about 8 weeks gestation. She came within 1 day of the date that I had estimated. That baby, Fiona, my first child, was born 3 days before the due date that I had calculated based on my own ovulation tracking. If we had used the first day of my last menstrual cycle, my baby would have been 2.5 weeks late. My longer cycle would have dictated a completely different due date. So can you see how important it is that we calculate due dates based on actual data and information? And if you have an irregular cycle, how important it is that tracking that ovulation date can make all the difference in pregnancy outcomes. We talked about Julie avoiding a medically induced termination of her pregnancy because the doctor had miscalculated and not taken into account that she had irregular cycles. I can't tell you how many clients I have had doctors saying, you're growing a big baby, your baby's measuring big, look, your due date's in just a week, and they recommend that they medically induce. And then because we have tracked ovulation and the patient has information that they can advocate for themselves and their baby, and there's no other medical reason to induce other than we're concerned you're going to have a big baby, then they go on to be 40 weeks in 3 days or 41 weeks in 2 days and have a 7-pound baby, which is not too big of a baby. So having this information can help you advocate for yourself and for your baby. If you have found this video helpful, make sure you check out other videos on our YouTube channel or download the PCOS app today.